Hi friends, this is Dr. Apoorv Mehra. We are with the first chapter, the basics and imaging of orthopedics. When you look at orthopedics as a subject, it is one of those subjects where images have a lot of role to play. And this chapter will give you lots and lots of questions more when you talk about images. We are talking about the year 2021 and we're looking at the results beyond it. I wish all of you all the best, this being the first lecture in the series. This is my daughter. She welcomes you all to my classes, which have been classically called as Ortho Dhoom Dhadaka. ODD, name its origin as a history, which we will talk in subsequent lectures. This photograph dates back to our first birthday. When I started teaching, it just looks like yesterday. I thought, will I be able to do that? But more importantly, I felt responsible. And I made this slide as the first slide. I have never been able to start a lecture in last 12 years without this slide by my back. Thanking good God above with honoring me the responsibility to be a student and interact with the other students. This is my name. It hardly matters. What matters is I train people to solve questions. More importantly, I tell them it is just not about the question. It's about the options. One question can have two correct answers. You can only score if you choose the best correct answer. That is why never mark a question without reading all the four options. This is one dictum which every student of orthopedics or entrance exam should remember. Always read all the options, A, B, C, D, D, C, B, A, all of them. Going further, orthopedics per se has two spellings. Both are correct. Ortho means straight. Pedics means child. Orthopedics means straight child. This term was coined by a scientist called as Nicholas Andre. Look at his wonderful hair lock. He was the pioneer. He was French, gave the name, the emblem, wrote the first book, defined the branch. He was appropriately called as the father of orthopedics. Nicholas Andre. Now this name is going to be there with you for long. Another scientist who did lots and lots of work, brilliant, British, called as H.O. Thomas, Hugh Owen Thomas. He did so much work that Britishers actually labeled him as the father of orthopedics. But since the seat was already occupied by Nicholas Andre, he was called as the Britisher father of orthopedics. He contributed with some of the very important things like Thomas splint. Splint is any device which will immobilize a joint above and a joint below. So if you have to immobilize the forearm, it will immobilize the wrist and the elbow. One joint below, one joint above. Rule of splintage. Roll, immobilization. He also gave called as wrench to correct deformities. It was not very popular, is not being used now. Thomas gave a test called as Thomas test, which talks about the flexion deformities of the hip. Trust me, if I have to remember one contribution of Thomas, it is the Thomas test which I should remember. And that is why that's the most common question asked from this area. And the other thing which he gave was the collar, the cervical collar for the neck injuries. Thomas also gave one more thing called as CTV shoes. Congenital talipus equinovarus, CTEV. For this, Thomas gave the shoes. So he gave 5 things, but if I have to remember one, I will take home Thomas test. The world is run by competitions. If there is one father, there will be one more. So, who is the father of orthopedics? Actually, we have a paternity issue. But if there's a fight and you get a question where you have both the options, Nicholas Andre is a better answer than Thomas. But you know, Britishers, they feel that they have created the world. So, another Britisher who was related to Thomas, he was nephew of Thomas, did a lot of work in orthopedics. Like Thomas, he had big name, but one thing which he did extra, he did lots of publications. And today, his name will be seen more in articles, literature. His name is Robert Jones. He was called as the father of modern orthopedics. And when they used to have classical DNB papers, they used to ask you, what is the relationship between Thomas and Jones? So remember, Jones is nephew of Thomas. You know, the history is the biggest teacher. If you want to predict your future, understand the struggle that occurred in history. And one of those who created the pinhole surgeries of orthopedics, called as arthroscopy, is Watanabe. Joint preservation surgeries is another name. And you know which is the commonest joint in which you do arthroscopy? Knee, followed by shoulder. Knee happens to be the largest joint in human body. Knee also happens to be the joint which is scoped most common. And then the largest joint is also the commonest joint where replacements occur, called as arthroplasty, and the father of arthroplasty is John Charnley. John Charnley can show you the spectrum of orthopedics. On one end, he fused a joint. Joint fusion is also called as arthrodesis. On the other hand, he made a technique of replacing the joint called as arthroplasty. Isn't it so wonderful? The entire spectrum. But in the history, what I've told you, if you need to carry home one name, H.O. Thomas, and one work, Thomas test. This is what is a summary of what I have told you till now. Let's look at the image-based questions. A photographer clicked this image. How many individuals can you see in the office? Now, when you look up front to this image, it just looks like an office with a lunch break, or office is over. But do you really think it's over? If yes, then why is the computer on? Because there is somebody beneath the table. Why is the almirah open? Because there is somebody sitting in. Remember the rule of images. You draw diagonals, You draw a plus, you make a circle so that you see every area. If you look at this, these are diagonals. This is a plus, this is a circle. That is the only way you can see the image in toto. So let's think about some ideas how to click an image-based question. Think common. That's the rule of life. Read common. Think common. Mark common. You will do very good commonly. Think rare. You will be successful rarely. Think the most simple thing. Prepare according. Whenever you look at orthopedics, remember few important things. If they talk about shoulder and they talk about shoulder dislocation, they will talk about anterior dislocation. If they talk about hip, they will talk about posterior dislocation. If they talk about a pediatric wrist, they will talk about rickets. When they talk about tumor involving lower end of radius, it is going to be giant cell tumor till proved otherwise. Common things they are asked. If they talk about nerves, around shoulder, axillary nerve, because there is axilla here. Around humerus, radial nerve. Around elbow, medial epicondyle, ulnar nerve. Around the head of radius, posterior interosseous nerve, branch of radial nerve. Around the knee, the common peroneal nerve, which takes a turn around the neck of fibula. Around the hip, the posterior border, the sciatic nerve. These are common things they will ask. Shoulder anterior, hip posterior, wrist rickets, tumor lower end GCT. Axillary nerve, radial nerve, ulnar nerve, posterior interosseous nerve, in lower limb, sciatic nerve, common peroneal nerve. Think common. Make things easy. People make it difficult. And then they ask why they don't get through. Because they don't follow the rule. Second rule, whenever you look at an image, see from a distance. If you go too close, you will miss the sight. So learn to zoom out. Identify, zoom in. That's how you pick it up. Keep distance. I have seen people, they will see a computer, enter inside. Don't do that. Stay up. Relax. Take it easy. Every corner matters. Look here. In this image, you will see legs here. In the corner. You have a head peeping at the top. The books somebody will be holding. These small things are big in entrance. These small things are big in life. Learn to observe. Then only you'll be able to do it. So, look at all the corners. Never hurry. Images are like relationships. The more time you give to them, the better they become. So if you give more time to images, they will talk to you. Listen to them. Don't hurry. In my country, every question has 40 seconds. 20 seconds belong to an image. Go easy. Remember, in orthopedics, localize the body parts. They love those areas. They will show you that and ask you that. Remember, go from normal to abnormal. An eye that knows how to see a normal can pick up the disease. Remember, don't hurry and look at the options. Look at the image, the question, and the options. And sometimes, in an image-based question, you don't need an image. Let me give you an example. Which freedom fighter is not seen in this image. So which freedom fighter is not seen in the image? And now everybody is looking at me. Dr. Apoor sir, where is the image? But before we fall prey to it, can we just look at the options? Can we look at the options? Is there a talk about the 4 freedom fighters, or there's a catch? Options are Gandhiji, Lokmanya Tilak, Bhagat Singh, Mickey Mouse. Do you really think Mickey Mouse can be an answer? So sometimes things are so obvious. We are blinded by pressure and anxiety to not see what is shown to us. As classically, a story of Sherlock Holmes says, it's unnoticed. It's not invisible. Learn to see. Okay, now see. How many freedom fighters are there? Try seeing it. Many of you would say there is nobody. Many of you would say, are we doing orthopedics? Many of you would say, sir, it's just a tree. But eyes who are focused can appreciate the beauty in everything. After about 10-15 seconds, you will start seeing people inside. You will see Gandhiji. You will see Rabindranath Tagore, Subhash Chandra Bose, Bhagat Singh. And you know, if you are focused, you will end up seeing 10 individuals. Majority see 6, good see 7, focus see 8. Very nice people, they will see maybe 9. But if you are not deviating and you are ready to learn, you never know, you can see 10. So that's how images are. I went to Kashmir. My wife told me, go out and click a pic. I remember, it was a chilly morning. But when wife says, you have to follow. I went out, this is what I clicked. I saw a huge tree. You don't see such trees in Delhi. Kashmir is God's heaven. You could see everything there. And then I could click this. And she said, that's the only thing you saw? I said no. But this was the biggest thing I saw. She said, let's go out. This is orthopedic Kashmir. This is what she clicked. You know, she clicked the sky. Beautiful mountain. Wonderful garden. Lots of trees. Some fountains, some monuments. I said, even then, largest is the tree. She said no. Larger than the tree is the garden. I said, okay. More than the garden. And largest is the tree. She said, no, the mountain. I said, then there's a tree. She said, no. The sky, which is above everything else. So when you go too close to the tree, you lose the sight. So learn to see things from a distance. That's the golden rule of achieving more than the crowd. And then, one of the commonest images is in orthopedics. Upper limb or lower limb? Upper limb. Beautiful. We can see humerus, we can see ulna, we can see radius. And if you pick it up, you will see a fracture of ulna. So when you see in this image, fracture of ulna, you see tree. But when you see the fracture of ulna with dislocated radial head, you see Kashmir. And you will only score when you mark Kashmir. Because question would be diagnosis. First option, fracture ulna. Second option, fracture radius. Third option, fracture ulna with dislocated radial head, which is also called as Monteggia. So friends, if you mark fracture ulna, you're not wrong. But if you mark Monteggia, you'll score. Entrance is just about achieving that near perfection. So when you look at this image, you know the question, photographer clicked it. How many individuals are there in the image? The word photographer is colored. It's a different color. It's in yellow. You know why it's in yellow? Photographer has clicked that image. How many individuals are there in the office? So whatever is in the image plus 1 for the photographer, because he was also there in the office. This plus 1 will decide your rank. So when we start looking, you will see inside the almirah, the legs on the corner, somebody beneath the table, somebody's hand, somebody's head, somebody holding the book, somebody on the corner, walking out, hanging beneath. And if you learn to count, this is something called as 10, and you will answer 10 plus the photographer, called as 11. This is the secret of learning the images. See what is unnoticed. Don't try to find the invisible, because nobody can find out.